Hi, Nick. Where's that Beth? Mm-mm.
No, that would be me, Myrna.
Huh? Who's that, Nick?
Yeah, that's me.
Hey, how you doing?
Oh,
So you have the
busy.
name for the other nurses, correct, that are joining?
Yes.
All right. So some other nurses may watch, but I asked Beth to make sure you knew just to let the ones on that list to join.
Yeah,
As-
Lisette, yourself, Esther, Sharon, Francesca, Cynthia, and Ellen.
Right. They should be on. I told them to join at 6:15.
I'm here, Myrna.
Oh, hey, Esther, I didn't see you.
Right here.
Good old Esther. Thank you. Pulling up my, oh, did I pull up my questions already?
I'm here too, Myrna. I didn't know I was presenting, but here I am.
Well, I sent you the email, so you should review the question that was assigned to you.
No, I understand that. I just thought I was going to be available to answer any questions that came up. So
Well, you
This
are,
is different.
that too.
Okay.
I'm not on video yet. Hold on, I gotta get my iced tea. Don't you look pretty for the camera?
Really?
Yes, you do. Esther, I
Same
don't
thing
see.
I wore to work today.
Well, then that's a good thing. Hold on, let me get my iced tea.
How are you guys doing? Esther, Francesca, you guys doing okay?
Yes, I'm doing okay.
Awesome. It's nice to see your faces. I miss everybody.
Good. Nice to see you face too, Ellen. I'm doing good. How about you?
Doing okay. My son's coming tonight. I told him he had to tiptoe.
Oh.
I said to him, I might be speaking. You need to tiptoe.
Okay, I have the dogs. I don't know if you can see right here in the window.
Yes, look at how cute. My cats may jump up too. How funny.
They're like, I said if they start making noise, I have to put them out,
Don't forget, you guys are being recorded right now.
Oh, okay.
Oh, okay.
Recording's on.
Yeah, so don't say anything bad about Myrna.
Oh, that's hard. Okay, let me put it on mute.
You don't see my face, but I'm listening.
Myrna, do you know if we have a translator tonight or is it just straight English?
Yes, Anna Lynn is translating.
All right, let me go get my laptop then because I can't do a translator without the laptop.
All right. Hi, Francesca. Francesca was the hero today. She worked at Hubbard School.
Oh,
Thank you so much. Are you at work now?
No. I'm home.
No?
Yeah, no, I'm home.
It looks like work.
Yes. I went to the home office.
Okay. I always have to put I'm in my kitchen, so I have to make sure I'm presentable here. I should have told him this. Nick,
Yes, ma'am.
Yeah, can you stop the recording till we get more people here, just so I could talk to the other nurses?
And this month, we are highlighting our school nurses. We're so grateful for all of our school nurses and everything that they have done for the past couple of years, and quite frankly, for all of their careers. So we wanted to take this chance to talk about the connection between the home and school and health, and how we can always connect with our nurses. And we just want to thank Ms. Lisette Ferreras. She's a social worker on the child study team, and she is providing the translation and for the Spanish speakers. And of course, we always thank our facilitator, Mr. Nick Gore, for getting us all on here. The format of the evening is we're going to start with some introductions. I'm going to have everybody go on around and introduce themselves. I have some pre-requested questions that we're going to target to specific nurses. And then by probably around 7 o'clock, we'll open up the floor to questions from our participants. Like I said, we do stop at 7:30, and we also need to stay on topic. I did have a few questions that did not pertain to our school nurses that I'll probably answer when we get to at 7 o'clock. But beyond that, I'm asking our audience to please, this evening is to really celebrate school, the school home connection, school nurses, and our health. So questions pertaining to that are perfect. Questions about other things like address verification or registration can be answered. You can call my office. I'll put my phone number in the chat, and we can always talk about that in a different venue, because we have our honored panel is our nurses. So we want to value their time and talk about school health. So I am going to ask everyone to introduce themselves, but I'll let our nursing supervisor, the phenomenal Nurse Dyson, start. And we want each nurse to give their name, their school, and what's something they like. How did you get into this field? What is your favorite part about school nursing?
Okay, thank you, Dr. Filipatos. So I'm Myrna Dyson. I'm the supervisor of nursing. This is my 22nd year in the Plainfield School District as a school nurse. Prior to that, I was a critical care nurse, emergency room nurse, and I also did community health for quite a while. So my passion is community health, and there's no greater way to reach out to a community than through the school. So I enjoy what I do. I love what I do. I have the best nurses in the world working with me. I also have to give a shout out to Dr. Filipatos. She's the best boss I've ever had. And we totally, we work hard to keep everyone healthy and happy. So thank you.
Absolutely. I'm not sure what position people are in on the screen. Nurse De Silva, you want to go first?
Sure, I'll go first. My name is Esther De Silva. My background is public health. I was the public health nurse for Plainfield Health Department before I became a school nurse. And I became a school nurse because I met the wonderful nurses in the schools. And they all invite me to become a school nurse. And like Marn, I love community health. And I really feel that, after I became a school nurse, I do, get so much more involved with the community, and I can do so much more. So I love that I can, through the kids, I can reach the parents, and I can help the Plainfield community, and the fact that I speak Spanish, and also the fact that I also came from another country. I'm from Brazil, so I know sometimes the struggles that, we go through, being an immigrant when you don't speak English, because back then when I came, I didn't speak English and I needed help. So it's something that, fills my heart with love. Like I love helping, the children, the families, and especially in this difficult situation that we have been living in the past 2.5 years. So that's me.
Oh, beautiful. What a lovely story. Thank you for sharing. Nurse Fry.
Hi, everybody. I'm Ellen Fry. I'm a school nurse in the Office of Early Childhood. And prior to doing this, I worked in recovery room, open heart recovery room, and the ER. And the ER was sort of like community health, because I worked in a New York City Health and Hospital Corporation Hospital, Metropolitan Hospital. Population was very needy, and I felt that I can help them when they were in the ER and maybe provide resources and stuff for them. So I like that community aspect. And I have a son who is on the autism spectrum, very high functioning and fine, but when he was young, the school nurse was invaluable in helping me. And I decided that I like that aspect of trying to work with the community as a school nurse. So I went into school nursing. And what I like about my job is helping the families and helping the kids so that the kids could be in school and learn and grow. And, every day brings something different. And I appreciate the support of Myrna and the other school nurses, and Plainfield's a great district to work for as a school nurse. So I'm happy to be here.
Thank you. What a great story. What a great story. And Nurse Francesca, I don't want to mess up your last name. I'm sorry, if you could go next. I always call her Francesca. That's her first name, but she'll give us her last name.
I'm Francisca Boachi. My first name is Francisca Boachi. And I've been a school nurse for almost, I think, more than 10 years. Before becoming a school nurse, I work in the community. I work with the Newark Health Department. I've worked with Plainfield Neighborhood Health before. And before becoming a nurse, I've always wanted to be a teacher. So I've always taught daycare, little kids here and there. So when I became a nurse, the best place to be is school nursing, so I can continue to do what I've always wanted to do. So I'm teaching from my office. It may be a small office, but the kids are learning from the office, and I'm happy to do I'm happy to be doing what I'm doing. Thank you.
Oh, wonderful, wonderful. Thank you. Nurse Hammond.
Hi, good evening, everyone. My name is Sharon Hammond. I'm the school nurse at Plainfield High School, and I've been in the district for 20 years. And my background is adult medicine. I worked in North Beth Israel. And the reason why I became a school nurse, I was always interested, but I needed to change careers for personal family reasons. And my first job was at Halbert Middle School. So at first it was difficult, but I do love school nursing because I realized the community, I live in Plainfield. I want to help my community, to bring resources, to relate to the families and students. And I really do enjoy it. It's a tough job, but I enjoy it. And I feel fulfilled when I see families reach out to me and we're able to work out whatever their goal is. And so I'm happy to work for Plainfield, town I live in. I want the best for our students and our families. And this is my way of giving back. Thank you.
Thank you, Nurse Hammond. Thank you so much. And of course, we have Nurse Sumner.
Hello, good evening, everyone. My name is Cynthia, and I am a nurse at the Office of Early Childhood. I have been a nurse for over 20 years. And I started out in medical surgical nursing, working in the hospital for 8 years. After that, I did home care for 8 years. So I am very comfortable in being in the community, interfacing with families and physicians. And the thing that I love about nursing is the challenge. I'm interested in breaking down healthcare barriers in our communities. I want the people that need access to healthcare to get that access. So I'm very interested in breaking those barriers.
Wow. Wow. What phenomenal stories. Thank you so much for sharing with us, ladies. And to our audience, you can see where our children are in good hands. We have so much, over 100 years of experience on the screen, right? And they're coming to us from varied backgrounds, public health, emergency rooms. Oh my goodness. And that was really interesting to me because I know you all so uniquely, and it just shows your passion is always shown. And the fact that you're here tonight, we just thank you so much for taking this hour to share with our families as well. So we're going to start with what we would call frequently asked questions, in case that covers some of the questions that the community may have. So that we'll throw those out first and get things rolling. And then after that, we'll open up the floor to participants. So Nurse Dyson,
Yes.
What is the best way to communicate with your school nurse?
Well, that's a good question. The best way is to call your school nurse. The numbers are on the district website, or you can send an email. So I just want to make everyone aware we are in the progress of having a web page put up for the school nurses where even more information will be available. But please, if you have any questions or concerns, contact your school nurse directly. And if you have any more questions after that, you can always contact me. And my name and number is on the website also.
Thank you. And you do always answer the phone. They all do. So we appreciate that. Okay, Nurse Hammond, what should I do if I have to keep my child home, but I don't have a doctor's note?
Well, what I recommend for people to do is to call your school nurse to inform them why your child's out sick. If you're unable to do that, I know a handwritten letter sometimes will be acceptable based on the school and the principal. But if it's more than a day or two, you really need to try to get a doctor's note. And please communicate with the nurse. Call them. We look forward to it so we know what's going on. Teachers, I know a lot of families or parents call the teacher, they tend to forget. And it's really our responsibility to know how well your child's doing or if he's not doing well and how we could help. So that is my recommendation. Definitely to call the school nurse. The numbers will be on our webpage. They're easy to on the directory. Write a note, have your child bring it in. Your child's too young, then please call us.
Perfect. Yep. We want to know, right?
Right. And I just want to add, Dr. Filipanos, that the Plainfield Health Center is always open and available for those who do not have insurance, okay, or who do not have a doctor. They are our provider and they do give excellent care.
Right. Absolutely. And just tell everybody where they are just in case.
Okay. Well, the health center is 1700 Myrtle Avenue on the corner of Rock Avenue and Myrtle Avenue. Everybody knows the health center. And they are always taking new clients. If you have an emergency, however, you need to go to the emergency room first. Don't wait around for an appointment. But if it's something of an urgent matter, you can contact your school nurse. They will contact me and I will certainly help them get in.
Oh, perfect. Thank you. Okay, Nurse Fry, why does my preschooler have to get a flu shot?
We go through this every year with our preschoolers. So New Jersey Administrative Code, actually the number is 857-4.19, says that children 6 months through 59 months of age attending any licensed childcare center or preschool facility shall annually receive at least one dose of the flu vaccine between September 1st and December 31st of each year. So when you come to the Office of Early Childhood to register, along with the documents that you need, we put on the letter that you get that you're going to have to get a flu vaccine because it's required. And in addition, if you come to school after January 1st, between January 1st and April 1st, you're still going to have to get the flu vaccine because it's a requirement. And the flu season can extend till May, as we know. And so getting the flu vaccine is protective, and we're trying to keep our preschoolers in school and safe. And so that's why New Jersey requires the flu vaccine every year.
Wow, that was an excellent answer. Parents ask that all the time. So thank you for giving that great information. Okay, Nurse Dyson. I got a letter from the nurse saying that my child has to get their shots updated within 2 weeks or they may be excluded. What does this mean?
So we still have to follow the state law for children getting their recommended vaccines. Things have kind of gone to the wayside in light of the pandemic. So we are really working hard to catch up. We do get audited by the city, and we also have to send a report to the state. So we are giving parents enough time. We're giving them information where they can go for vaccines for free. The Board of Health is open every Tuesday and Thursday for vaccines, and this is not pertaining to COVID vaccines. This is your MMR, your Tdap, TD, varicella. So we do need all of our children to be brought up to date with their vaccinations.
Thank you. Okay, Nurse De Silva, this is a question about quarantining. My son had to quarantine, but he said he was not near anyone that was sick. How did that happen?
That is something that, very common, because we know that sometimes you can be positive for COVID and have no symptoms, right? So you can be close to someone that is positive and, they let us know that the person is positive or the student is positive. And then, we have to quarantine who's closer to that person who tests positive. So a lot of parents ask the same question, but my kids don't have symptoms. They say nobody was sick. So you can have COVID and not have symptoms. Also, when you're in a classroom or in school per se, we don't give personal information who was sick, who really, who has COVID. So it's a private information. So someone can be next to you and just have a cough or have some signs and symptoms of a cold and be positive, but I'm not gonna let you know that that person is who was sick. So, but most of the time it's like that. You don't have symptoms. A lot of the kids, especially kids, don't have symptoms. And when they test positive, it's because they were in contact with somebody else. And then the family decides to do it, or it's just a runny nose, little headache, something, very simple that, before we never would relate it to something like COVID, but now, it can be.
Everything changed, right? A new way
Yeah.
of looking at it. Thank you. Okay, Nurse Francesca, I wanted to bring my child to the vaccine clinic you had at Stillman School, but it was very crowded. What happened?
Yes, the vaccine clinic was very crowded. We realized that at the end. We actually made every preparation and was really ready to serve everyone who comes in. But it just happened that we had so many people, and then because of that, we were not able to reach everyone who was in line. But first, we apologize that you came, you joined, you were ready to receive the vaccine, and we were not able to serve you. So we made provision. I think 2 weeks after, on the 10th of February, we had another clinic that was open to the public. But unfortunately, we did not have, the attendance was not as great as the first one. The neighborhood clinic is always open and they are ready to take students in. So you can walk in at any time and have the vaccine. Your child can still receive the vaccine, but we still apologize for you coming in and was not able to receive the vaccine. A preparation was made for everyone. Thank you.
I know you guys tried so hard, and I think what happened was that was during the height of the Omicron, and everybody wanted to get the vaccine on that day. And since then, we've seen a lot of waning attendance at clinics. But I know, Nurse Dyson, that you're planning some clinics at our schools, even still. So
Right. And we are having tentatively a clinic at Maxon School on a Saturday, on 2 Saturdays in March. And I have been talking to the Plainfield Health Center about having one at another school. So what we find is when we bring it to the community, people come. And that was what was so amazing the first night at Stillman, because we had so many clinics around at churches, the health center, but our line was still out into the street. So one thing that's true is that when you bring it to the people, they'll take the vaccine. So we are really trying to bring it to our schools community. And one thing, I'm not sure if I heard Ms. Biache correctly, but the health center is Wednesday and Saturday for their vaccine.
Wednesday and Saturday, and
Wednesday and Saturdays for the health center. So please, those people who attended Stillman the first night, if you have not received your second shot, please make sure, if you need a booster, please go to the health center on Wednesday or Saturday.
Thank you. And we still have Union County coming to Plainfield High School this Saturday from 9 to 1 again, that they've been coming every Saturday. So we've been getting a lot of community members that way too. So, okay, Nurse Hammond, I don't have health insurance. Where can I go for shots?
All right. Well, the first place will be the neighborhood house. the Plainfield Health Center on Myrtle and Rock Avenue. If you don't have insurance, that is the first place we always recommend, or I try to recommend for vaccines. And they do have a sliding scale or charity care. They also speak, English and Spanish. So they'll be able to serve you in that way too. The next place could be also the Board of Health. We also provide vaccines. Now they change because of COVID. You do have to make an appointment. Before you could go there with your documents, but now please make an appointment. Every nurse does have a flyer in their office or the phone number to make to contact the Board of Health. It's the same place to also give COVID shots there, but we're just talking about plain vaccinations, immunization that children are missing, not the COVID vaccines. And so they're very hopeful, and they also speak Latino Spanish. So just make an appointment, call. You have difficulty, ask your school nurse for help, and she will also walk you through it or make the appointment for you, because there are certain documents you must bring with you for the Board of Health, the vaccine clinic.
Really good point. We've all been kind of distracted with COVID, but all these other vaccines are so important. And your school nurse can tell you if you don't know where to go, if you don't have a medical home, you can always call your nurse and they will direct you. Okay, Nurse Subner. I have two children, one's 3 and one's 4. And I want them both to go to preschool. What do I need to do to sign up? What do I need to bring?
Okay, so 3 and 4-year-olds. This is their initiation into the public school system at that age. So what the parent wants to do is go to the Plainfield Public School District website, and you're going to search for registration, and then you're going to register your child online. Once you register your child, you will get a phone call from our office, the Office of Early Childhood. Someone will call your home and set up an appointment for you to come in and bring the needed documents that you will need to have in order to register your child into a preschool program or public school. For the preschool, your child will need a physical exam from their pediatrician. You must have a physical exam, and then you must have all the immunizations that are required for the school system for your child to enter the school. So those are the two main documents. There's other documents that you will need, but we will tell you that when we make your appointment to come in. But you're definitely going to have to see your pediatrician and have a physical and have an immunization document proving you have had all the required immunizations.
Thank you. Thank you very much. Okay, Nurse Dyson. I was told my child failed his eye test. I don't have insurance. What can I do?
Okay, we get that question a lot. Please reach out to your school nurse. We do have programs we can refer any child to, any student to, at no cost.
Yeah, at no cost. We have a great connection with eye doctors. So we do want to point that out. You know, Plainfield is a very caring community. We have so many resources, and your school nurse and really anyone in student services is your connection. So we always just ask you to ask us and we will help. So we are at 7 o'clock. So I'd like to turn it over to get some questions from our audience. So if you raise your hand, Mr. Gore can pull you over and we can see your face and you can ask your question. I do see that there, we had some comments in the chat, which was nice. Our board member, Ms. Carmencita Pyle, I'm so excited she's here. She said Plainfield Public School nurses rock, and she's right. So thank you. And our community liaison, Gloria Monteliegro Smith, said, great job, Ms. Ferreras. That means she's over on your side and she's listening to you, which I know she does that. So good for you, Lisette. You got a compliment from Gloria. So Thank you. And I do see Ms. Lynn Anderson Person, also our board member, is also listening. So we're honored to have our board members here. And I think maybe Ms. Anderson Person has a question. It's not written, so maybe she'll come over with to the panel side to ask it. Anybody have their hands up, Nick? Okay, let's see. I do see.
Yes, we have an Alexis coming over
Okay.
from Gmail.
Okay.
We'll see if she accepts.
Okay.
No, she declined. So I'm going
Okay.
to try one more time. I'm going to allow them to talk instead of asking them
Oh, there
to
she
come
is.
over.
There she is. Thank you so much for joining us. You have a question for our school nurses? And you can ask that question in Spanish. Nurse De Silva will tell us what you're asking. You want to tell them that after that they can ask in Spanish?
You want me to tell them?
Yes, please, because now they're here, they can't hear Lisette.
Ok, senhor que está aí en la línea, pode hacer la pregunta en español.
Oh, sí.
Sí.
Bueno.
¿Tiene alguna pregunta, señora?
Oh, no, no tengo ninguna pregunta, solo estoy escuchando lo que están hablando.
Ok, pero então não tem pergunta nenhuma.
No.
She's saying she doesn't have a question. She's just like, listening.
Oh,
Okay.
thank you. Thank you for coming. We appreciate that. We're so happy.
There is a question in the chat box.
Oh, okay. Let's
I don't
see.
know.
Oh, from Siobhan. It says, thank you for all this information. Is there any update on masking in school in light of Governor Murphy's latest legislation? Absolutely.
That I can answer that one. That's a great question. Our policy is we will still be following masking guidelines. Oh, I'm sorry. Masking guidelines until we are in the green zone. Right now, Union County is yellow, which is a humongous jump from red. So the numbers are definitely going down. But we will not, we will continue to wear masks, until we are green. And please remember that we will still be following social distancing. The nurses will still be contact tracing. The hygienic procedures will still be in place. Hand washing, all the rooms get sanitized every night by our Buildings and Grounds Department. So Plainfield will be continuing masking until we are green.
And Nurse De Silva, what does it mean as far as public health to be in the green when Union County would be in the green?
I'm sorry, say that again?
Oh, I was asking,
Oh.
yes.
Oh, okay, go ahead.
It means when we are green, it means that the transmission, the rate of transmission is very low. And we're yellow right now. This is like great.
I know.
Right, it's great. We're going, we're going to the right direction. So
Right.
hopefully soon we're in the green, and then we can lift some of those restrictions. But I think keeping the mask, like Marna said, and everything that Plainfield has been doing, the Board of Education has been doing for the schools, it's a must. But hopefully we're gonna get to the green.
Right.
Right.
And even when we do get to green, children, adults, everyone always has the option of wearing a mask.
Right.
I'm sure some people will continue to wear masks, and that is totally their choice. So great question from the chat room. And I see we have Miss Lynn Anderson Person, our board member on the panel side. Good evening. How are you?
Mute and get off. I'm super duper casual. So how are you?
Great.
Well, first of all, nurses, excellent presentation tonight. Thank you. It's very nice to match the names with the faces of the nurses that are inside our district. And it was really very interesting hearing about your background in nursing and what you're bringing to the table. Pretty much a few of the people before me got my questions answered. So thank you. To the other members of the public. And in terms of the changes inside, I know I had asked a question just regarding the temperature machine, because initially in September, there was a process in terms of kids coming in and getting their temperatures taken. Could you just speak to that a little bit about that change?
Sure. Hi, Miss Person Anderson. It's Miss Dyson.
Yes, nice to
Nice
see
to
you.
see you. So what the CDC now recommends is to have at least one method of mitigation for COVID in the schools. So masking is a mitigation, something that will lessen the risk of transmission. We found that temperature taking really did not provide us much data. We didn't find many students with temperatures. However, we did find students who didn't look well, who didn't feel well. So the nurses, we always ask the teachers, please send that child to the nurse for an evaluation. And then we will recommend for testing. But temperatures alone are not indicative of COVID.
Okay, so thank you for that. So is the reliance going to be for myself as a parent and other parents, that if our child's not feeling well, keep them home? But if they're in school, is the reliance going to be on the teaching staff to notice changes in their students? I mean,
well, I'll tell you, teachers are very astute at picking up. They see the child every day. And we're not making nurses out of the teachers, but they certainly know when someone doesn't feel well.
Okay.
Or doesn't look well, and we ask them to send them to the nurse. We are starting a program where the parents will be able to test their child if they are called that your child has COVID symptoms. The nurses were given at-home tests that the parents can do in front of the nurse, which will give us instant results in 15 minutes, and we can begin contact tracing right away.
Another follow-up question. Thank you for that. I noticed that the state was saying that several pharmacies would be giving out free tests, or you could log into a website and have them sent directly to your home, the at-home tests. Do you know
Well,
what I mean?
I did it through the United States Post Office. I got the link and it came within a week.
Okay.
So I don't know about the drugstores, but I know through the federal government, they did hold true to what they promised.
Yeah, I think it's the mask that people can pick up some extra ones at no cost at the pharmacies. And I think it's the test that they can go online and order.
Right.
So is that something that we have on our website so people will know that? I mean, I was just watching the news and picked it up, but I just was curious how we're communicating
Well,
that.
that's a good question. I did see something in a local paper online that not all pharmacies have them yet.
Okay.
Okay, so we want to make sure if we're going to direct people to Walgreens that they have them. So once we can collect that data, we can certainly put it on the website.
Okay, great. Thank you very much. And again, ladies, thank you so much. It was really, really good presentation.
Thank you.
Thank you.
Okay, let's see if anyone else has their hand up or if there's any other questions. I don't see any hands up. We do have 25 altogether participants, so that's great. And of course, this and all town halls are taped and then they're placed on the district website. So if you heard something earlier and you want to go back and remember what was said, you can always go to our YouTube page and click on town halls, and all the town halls that we have are there. So
can I just add one thing, Dr. Philippotos?
Absolutely.
So I am in the process of building our website, and I want to let parents know that the forms will be there where you can download them and sign them and bring them into the nurse for medication, for asthma. There'll be a seizure action plan and a food allergy plan. All that will be online within the next couple of weeks. So please look for that. There'll be a lot of information there. And we are also looking into another program where we'll be able to medicate your child in school. Once that gets moved on through the next system, I should say, so we can keep your child in school. So we're very excited about that, working with our school physician. And please look for our webpage. It'll be up soon.
Thank you. And actually, I did have a question for Nurse Hammond. My child has to take medication. What should I do if they have to take that medication in school?
Well, first, we do have medication forms that we will hand to you. Your doctor has to fill it out. The parent has to sign it. Once we have that information, we send it to our district doctor. And then once that come in, the medication, we need the medication in original container with the name and the prescription on the container. And then if it's not enough, the parents would take half, we would keep half at the building locked up. And during that, we have a set time. The doctor puts a time and we work what time is best. If it's the morning, afternoon, or early afternoon before leaving for school. And then that child walks down, we give them the medication. But you definitely have medication forms that have to be signed and approved by the district. So if you have any questions about medication, please talk to your nurse. We have the forms come in. Those are types of things I always encourage parent-teacher conference to talk to the nurses. When your child has a health problem or concern or they're on medication, you really should talk to your nurse before school starts in September.
Yeah.
That's how I feel. So they get to know them, so we can meet the child, talk to the teacher, make sure he's doing okay. If the child is not coming to school or sick, you should contact the school nurse to let them know they're not in the building that day. But we do have forms that need to be filled out, and we'll share. You bring medication to the school with original container, with the forms, and that's what's needed to have medication done in school.
Perfect.
And the forms are good from September to September.
Perfect.
And every year they have to be updated. It can, you just can't assume, even for asthma, every year our medication forms are updated.
Perfect. Well, I don't see too many questions in the chat or in nobody has. Oh, someone has their hand up. Oh, Miss Anderson person, is that you coming back with a hand up? Let's see if there's anything in the chat. Let's see. Oh, here she comes.
Yes, I just have one quick question. You had mentioned note, and typically I'll send the note to the teacher and the office, main office secretary. And then there was something that you were saying about if the child is sick and you don't submit a note. Isn't there something where in terms of counting a child, in terms of the number of days that the child is in school, we know that they have to be in school 180 days, but they were telling us before that some things that parents thought counted as a, I'm trying to think what I'm trying to say here. In terms of if a note is recognized by the state, if a child says that they're going to be out sick, are there some conditions where that note is not accepted?
Okay.
I
think
Tyson, you want to answer that?
I understand.
Right. Well,
Yeah.
I'm going to actually defer that to Dr. Filipatos because I think that's a state mandated kind of question.
Yeah.
But I think what Ms. Anderson person is referring to is what's acceptable as a excused absence, right?
Yes,
So the
exactly.
state register has different definitions. So I'll let Dr. Filipatos answer that one.
So it's actually much worse. Really no absences except bring your child to work day are excused from the state. Unfortunately, it's the school's policy to get the doctor's note because we want to make sure our children are okay and then work with families. If a child has to go on home instruction, then that's their place of instruction and those absences are of course excused. But as far as the state's concerned, they want the students to come 180 days. And if they're after 18 absences, they're considered chronically absent. So it's tough. The notes really more for our nursing staff because they like to follow up and make sure that the children are okay.
Okay, so the note again is just for you, the school district, but for the state, it doesn't mean anything. Okay, all right, thank you so much.
So actually, we have a question came in from our our community liaison. Do you want to come over and say that on the panel, Gloria? because I know this is true. Ms. Montaliegro has the, her email address is called communication@Plainfield. And here she comes. I'll let her explain it. She gets a lot of emails about being sick, and it's kind of hard for her to field them. So can you hear us, Gloria? We see you on the screen, but you're still muted.
Oh, sorry about that.
Oh, there you go.
Can you see me on the screen?
Can't see you, but we can hear you now.
I'll turn my camera on. I
Oh,
apologize.
there you are. Hi.
Muy buenas noches. Good evening. So yes, I wanted to let parents know that I'm the one that looks at the website when you send messages, that little envelope that appears on our main website. So I'm not your school. So I sometimes I see the message later that afternoon or the next day. And so if you think you're communicating with your school directly, it's best to actually communicate with your own school. And our general number is 908-731-4200. And that phone number will give you the opportunity to locate your own school and leave a message with your school. Because when you use the mechanism on the website, you're reaching me. I don't have, many times I might not read your message on time.
But you do a good job of forwarding those messages. And I know that you always get them to the right place. So we want to just make sure we connect.
Yes, we don't want to, it's nice that you're trying to communicate with us. I really, truly appreciate the fact that you are looking at our website, that you at least know where to leave a message should you need to get word across. And I will try to look at those messages more diligently earlier in the morning. But like I said, it's best when you communicate directly to your school. Thank you.
All right. So, they asked you for the phone number, but you did give it. All right, let me type it.
Teléfono, yes. El teléfono es el área code 908-731-4200. So the telephone number is 908-731-4200. Thank you.
Thank you. Thank you. Well, it's actually 7:20, so this would be the time that I would ask to wrap up. And we always like to give our panelists the last word. So the nurses, if we could go around and, just say what you would like, what you want your parents to know, what you want them to take away from this evening. And we'll let Nurse Dyson go last this time. We'll start.
I'll go last this time.
Yeah.
And I have one more thing to say about.
Yes, go ahead. You could go first.
Sorry. Hi. So I'm from Plainfield High School, Nurse Hammond. And so we do have a lot of students with injuries. And no one mentioned that. Injuries are very important. Any type of cast or splint or arm brace, they should always be reported to the school nurse. You should always inform the school nurse before the child goes to his class. I tell parents, before they go to homeroom, come see me. We do have excuses if they need an elevator, if that school has one, or they have crutches, they need extra time to get to class. We do have nurses' notes or permission that students could leave earlier, or they need a buddy to help them in the younger grades to carry their books or their book bag. Or for lunch, they get their lunch first so they won't be crowded and get re-injured in the hallways. Somebody could carry their lunch tray. So that's very important. But we also need the doctor's note, the orthopedic note, that if the child has to use a crutch for a certain amount of time, everything has a time and a date, 2 weeks, 1 week, a day. So please make sure those notes get to the doctors, not to the teachers. That's really a medical note that really should come to the school nurse, so we know ahead of time. I used to feel, really bad if you don't see someone, especially in the middle school and high school, and it's the days I've always done, and someone is on crutches or have a brace. We don't want them to get re-injured, and that's also for PE classes. Nurse Dyson could add any more to that, but thank you. I hope we have more of these, and I hope people learn a lot from our town hall for the nurses' first town hall meeting. Thank you, Nurse Dyson, and our Ms. Filipados. I appreciate it. You know, we really need to show that we're here and we care about our community, and we work very hard for our students and staff.
Oh,
Thank you.
do. You work so hard. And the last 2 years, I'll even cry if I start thinking about it. But I'm so grateful to have such wonderful nurses. So I'm so glad we were able to share that. Yeah, I am crying. All right,
Thank you.
Nurse Fry, let us know. Let's get your final thoughts.
What I want to take away is that as to piggyback on what Sharon said, it's a great, and everybody has said, it's a great group of nurses. Thank you, Myrna, and thank you, Dr. Filipados, for always including the Office of Early Childhood. And I just want to let the parents know that they're trying to register their child for preschool and they're struggling with getting immunizations or physicals or anything that they need, they can reach out to the nurses in the Office of Early Childhood and we will try and help them, because we want their children to be in school. And just remember, if you're coming to the Office of Childhood now, between February through April 1st, make sure that in addition to your preschool shots, your child has your flu vaccine, or you won't be able to register the kids. So we're there to help you in any way we can. And always keep that in mind, that your nurses are here for you.
Thank you. Thank you. All right. How about you, Nurse De Silva?
Again, I also want to say thank you to this group of people that I work with, all the nurses, and Marna being an amazing boss. And you, Dr. Filipados, thank you so much. I know we are together because, everybody does a lot. One thing I want to let the parents know is that reach out to your nurses if you need something, even if it's a dentist appointment, you child need a dentist or eye exam, because Plainfield has so many resources, and we always can, direct you. If you don't have it, we can direct you to someone that will, help you with that. I am so honored to work for Plainfield because of that. Like every time I think, a parent needs something or a student needs something, there is always some place that, they can go in Plainfield, which I know I don't live in Plainfield and I don't see on my, my town. So, so reach out to us, to the nurses, if it comes to health and anything like that, so we can kind of direct you to the right people. And again, I want to thank you so much for, giving us this opportunity to talk a little bit what we do and how we can help. And, and thank you, my friends, my nurses friends, for helping when we need it also, like we relay on each other too. So it's a great group of nurses in Plainfield. Thank you.
Absolutely. The nurses network is so phenomenal. When one needs help, there's someone right there. They're always covering each other, contacting each other, conferencing with each other. You ask one nurse and the other nurse already knows the answer. So it's an amazing network. So thank you for pointing that out to Nurse De Silva. And Nurse Sumner.
I just want to thank our supervisor, Ms. Dyson, and also Mrs. Filipados for this opportunity. Just to the community, your nurse is one of your greatest advocates. We are here for you. And we realize now that health and education go hand in hand. So we want students to be healthy so that they can learn. So just reach out to us, we're here.
Right, you got the connection. That's exactly right.
That's the connection.
Nurse Francesca?
I just want to still encourage the parents that the COVID vaccine is safe with all the challenges, whether you are in line for a long time or not. It's really good for your child to receive the vaccine. We are happy to keep the children in school. We are ready to serve your children. So please go to the neighborhood health, whatever you have to do to get a vaccination for your kids. It's very important and it's safe for the children, for them to be in school. Thank you all also for coming. And thank you, Ms. Filipados and Ms. Dyson. Thank you for the opportunity. Thank you.
Oh,
Thank you.
right, Nurse Dyson.
Okay. It's very heartwarming.
I know it is. We just needed it. Sometimes we need our cups filled, and you guys have filled our
to.
cups. Thank you very
Right,
much.
right. So I can't thank the nurses I work with enough for all that they do. I pull on them constantly. Can you do this? Can you do that? Can you work here? Can you work there? They cover each other. They help each other. They support each other, which is really, really phenomenal. But one thing I want our school community to be aware of, through the pandemic, these are your frontline workers, right? The nurses, not one nurse came to me and said, I can't do this. I won't do this. They were there. So when a teacher may have 1 or 2 ill children in their classroom, sometimes the nurses have 7 or 8, okay, and are putting themselves at risk to take care of our children. So I'm glad, thank you for all the comments in the chat. These are your frontline workers taking care of our children. I too am an original Plainfielder. It's in my blood. Okay, Plainfield is in my blood. So I love being here. I'm proud of Plainfield, and I just love it. I love what I do. So thank you for the opportunity. And thank you to all of the nurses and the administration.
And it's clear that you all do love what you do. It comes out, and I couldn't, Plainfield, I'm so proud of Plainfield too. I think that the way we wrap our arms around our community is really, really what makes us special and different. So we're so glad you joined us. We did have 27 participants, and we're really grateful for everyone who tuned in. We really like the format of the town hall. Student Services has made a goal at the beginning of the year to have a town hall every month, and we have stuck to our goal. Just so you know, in March, we're going to be highlighting our Family Success Center with the Family Success Center. Let's work together. And that will be a town hall that will both be in hybrid and online and in person. In April, we're going to address equity and say, what is equity in education? And that should be, that's a topic that's very timely. And we're all going to come together and talk about that. And in May, we're going to start getting ready for summer with our intervention department. And they're going to say planning for summer. Let's focus on academics. So giving parents some things for their toolbox. So we really, we want to strengthen our connection with all of your homes. We thank you so much for joining us. And, thank you. And everyone have a great night. We don't have to be safe because we just get to log off, but it's great to see your faces. Okay. And the chat, just so you know, the chat is filled with love. So
thank you. Thank you to everyone. Okay, have a good night.
Good night. Good night.
Good night.
Good night, everybody.
Good night.
Bye.